In the intricate world of clinical cardiology, the electrocardiogram, or ECG, is a beacon, guiding healthcare providers through the maze of decision-making. This vital tool sheds light on the heart's electrical activity, offering clues to rhythm and potential abnormalities. Let's delve into how ECG results steer the course of diagnosis, risk assessment, and treatment. When an ECG reads normal, it's like a sigh of relief, suggesting a low probability of acute cardiac events. Yet, this is not the end of the road. Providers may recommend routine follow-ups or additional tests, weighing the patient's clinical signs and risk factors. The ECG can also reveal a more urgent narrative: ischemic changes, ST segment elevation or depression, and T-wave abnormalities signal myocardial ischemia. If ST segment elevation is detected, it's a race against time, as it may point to an acute myocardial infarction, demanding immediate reperfusion therapy. Abnormal rhythms, such as atrial fibrillation or ventricular tachycardia, are like unwelcome plot twists. Each arrhythmia type prompts a tailored treatment response. Atrial fibrillation, for instance, may call for anticoagulation to avert stroke, while ventricular tachycardia could lead to more in-depth evaluation and management. Conduction system abnormalities, like bundle branch blocks or AV blocks, are akin to roadblocks in the heart's electrical pathways. They necessitate specialized evaluation, and in cases of advanced heart block, might even lead to pacemaker consideration. A prolonged QT interval is a red flag, raising the specter of torsades de pointe. It prompts a thorough risk assessment and a review of any medications that could be extending the QT interval, possibly unveiling congenital long QT syndrome. Baseline abnormalities or aberrant conduction patterns are puzzles to be solved. Are they benign, or do they herald further investigation? For instance, a left bundle branch block can alter the interpretation of future ECGs. ST segment changes consistent with myocardial infarction are a clarion call for immediate action. This could mean activating the cardiac catheterization lab for percutaneous coronary intervention or administering thrombolytic therapy, depending on the situation's urgency. Dynamic or evolving ECG patterns suggest a story in flux, with ongoing ischemia or cardiac events unfolding. This scenario demands urgent cardiologist consultation and possibly advanced cardiac imaging or interventions. Recognizing specific ECG patterns, like Wellens' syndrome, is crucial. Such patterns can indicate high-risk coronary artery disease, necessitating urgent intervention. ECG findings do not stand alone. They are part of a larger narrative that includes the patient's symptoms, risk factors, and medical history. This integration is pivotal for informed decision-making. ECG results are the compass by which cardiologists navigate. They inform management plans, influence treatment decisions, and dictate the urgency of interventions. Optimal decision-making is a symphony, requiring the close collaboration of cardiologists, emergency teams, and healthcare providers, all harmonized by the rhythm of the ECG.